Hi, I am Dr. Luis Campos, and we're gonna start with this uh, mask. This is a regular surgical mask. We're gonna start by talking about how to install an N95 mask, something that should be left for the people that are taking care of coronavirus patients. It has to be adjusted. You come with two-hand approach after you have cleaned your hands and put it in your nose with two hands. After you adjust it in your nose with two hands, you adjust the lower part. Then you get one of the straps and you put it on top. And then you get the lower strap and you go behind it and put it in the back. So now you have one in the back, one on top. In this way, you have a sealed N95. The reason of this video is to talk to you about the intensive care of a patient at home of coronavirus. You need to learn how to measure the respirations of the patient, so you need to have a clock like this with the second hand. So while the patient is in bed, you put your hand in between the ribs and the stomach. And then watching the clock, you can measure how many respirations there are per minute. Normal respiration per minute varies between 7 to 15. A patient in distress is going to have 20. At 25 to 30, we call 911. We have other things that I want to tell you, and one is about Tylenol. With Tylenol, if the patient is with nausea and vomiting, you can administer rectally, but they need to control the temperature. There are many other things that you need to be ready. The lack of oxygen is what creating a cascade into this body in order to eventually take it away. We need to avoid that lack of oxygen by either administering oxygen, if you had that opportunity, like to have a nasal cannula in here, which administer 4 liters per minute. You can imagine if that's the need for liter per minute, you need a huge tank of oxygen. That can only be done at the hospital unless you are a previous patient of asthma that has been taking oxygen. So having a little bottle of oxygen of 1 liter is totally meaningless. It's better to keep your lungs clear by the exercises that I have taught before, that include exercises in the expiration and exercises in the inspiration. I want to complete this short video in order to tell you that you're not alone. 80% of the people get better. When you call 911 is when the respirations are very difficult, and I want to remind you also that it is very important to know what medications you were taking before. In my experience, taking care of very severe male patients, I have found out that they had been taking Viagra in the past, and as soon as I put them back on the Viagra, there was a noticeable improvement. And we know for sure that the pulmonary hypertension is affected by the sildenafil. So it's very important that you keep taking your antihypertensive medications. Thank you for watching. Thank you for listening. As an addendum, I want to talk to you about the pulse oximeter. The pulse oximeter is an apparatus that looks like this. It's based on batteries. So we open it up. I put my finger in there, and then I turn it on. And you will see it's measuring my pulse as well as my oxygen saturation, arterial oxygen saturation. That's 98. It's never 100. 98 to 99 is the normal. Patients in distress will have 92. Patient less than 89, we're going to the emergency room. It's a beautiful apparatus. It measures the constant oxygen. It's usually done on a permanent basis when we're taking care of somebody in distress. But you need to know that it's based on the color of the skin. So the color of the nail is what's being measured in here. So it's important that women remove with acetone any leftover nail polish. And saying that, I want to tell you that in reality we don't need this, because if we stick out our tongue in front of a mirror, we can see the nice rosy coloration that the oxygen gives, and when there is a lack of oxygen, there is a bluish discoloration. Thank you very much.